Today, we are going to talk about the 5 negative effects of abortion. Will an abortion affect you when you get pregnant in the future? What side effects should you expect after an abortion? Can you get pregnant after you have an abortion? Stay till the end and we will tell you all you need to know about this. Before we look at the adverse effects of abortion, let us consider what exactly abortion is. This word, simply put, comes from the word abort, which means to stop. In common parlance, when we use the word, it is usually in relation to a medically induced abortion or the termination of a pregnancy. Now, an abortion can occur naturally or through human intervention, through medical or surgical means. Natural abortion is what we commonly refer to as a miscarriage. A medical abortion can be conducted for 2 reasons. The first being the therapeutic abortion. This is carried out when there is a medical determination that the mother would face difficulties during the term of the pregnancy and her life is at risk. So, this procedure is carried out to save the mother's life. In some cases, doctors are able to determine if the child will be born with severe birth defects or congenital conditions. In such cases also, a therapeutic abortion may be carried out. The second type of abortion is the elective abortion. The elective abortion involves the separation of the child from the mother with the purpose of ending the child's life. Now that we have discussed what an abortion is, let us look at the negative effects of abortion. The first issue that we are going to look at is what effect an abortion could have on future deliveries. One issue that has been noticed by many doctors and researchers is that abortions cause the weakening of the cervix. The weakening of the cervix is linked to a higher chance of preterm deliveries in the future. In 2009, a study was conducted on the link between induced abortions and low birth rate and preterm deliveries. This study came to the conclusion that if a mother had a previous induced termination of pregnancy, there was a high chance that during future pregnancies, there was an increased risk of premature birth. In addition, in future deliveries, the infants were likely to have low birth weights. It was also found out that after one induced abortion, the risk of a preterm birth in the future increased by around 25%. In case a woman had 2 or more abortions, the risk would increase to about 50%. A 2013 study conducted in Canada also showed similar findings. They also found that in case of future births, there was a higher risk of developmental disorders like cerebral palsy, autism, and mental impairment. The second issue we are going to look at is the link between abortions and breast cancer. Most women who go for abortions are on their first pregnancy. The first full-term pregnancy causes breast cells to mature. This maturation of breast cells potentially has a protective effect. So, research tells us that among women who have had an induced abortion, there was a 44% increase in the risk of having breast cancer in the future. The relative risk increased to around 80% when women who had more than one abortion were considered. However, this link has not been completely established. We still don't have a consensus on the issue. There are also studies that indicate that having an abortion may reduce the risk of developing breast cancer. The third issue that we are going to consider is the risk of contracting STDs and PID. Even if someone does not have the symptoms of chlamydia, in case chlamydia is present in the cervical canal when the abortion takes place, there is a high chance of the development of PID, or pelvic inflammatory disease. Now, experts tell us that PID can have some serious consequences. Infertility, pelvic pain, and ectopic pregnancies are linked with pelvic inflammatory disease. The fourth issue that we are going to discuss is mental health. Abortions have been linked with certain mental health issues. In some cases, women have reported that they felt a form of PTSD or post-traumatic stress disorder after their abortion. Some other common complaints include regret, sadness, depression, guilt, or even suicidal ideations. The final issue that we will discuss is how abortions may cause infertility and sexual dysfunction. In some cases, it has been observed that abortions may lead to complications. These complications can cause damage to the reproductive system or infections in some areas. In addition, some women have reported issues like vaginal dryness, reduced sex drive, and inability to orgasm after having an abortion. In some cases, there have been reports that sexual intercourse, later on, became painful. So, abortions are also linked to sexual dysfunction. Now, it is crucial to remember to consult a doctor in case you or someone you know is suffering from these issues. In case of mental health issues, make sure you consult a mental health professional at the earliest. In case you are planning a full-term pregnancy after you have had an abortion, be sure to visit your gynecologist and have an open discussion regarding all of your concerns. Now that we have discussed the adverse effects of abortion, let us take a look at induced abortions. We had previously talked about induced abortions in general. Let us now look at the different kinds of induced abortions. The first is the medical abortion, which is usually done within 9 weeks of the pregnancy. Here, medication is given by a doctor or medical professional, and this medication will terminate the pregnancy. The medication is usually a combination of drugs like mifepristone or misoprostol. Mifepristone blocks the hormone called progesterone. This hormone is required for a pregnancy to continue. In the absence of progesterone, the uterine linings become thin and the embryo is not able to stay attached to the uterus. Then, misoprostol helps to contract the uterus, and it causes the embryo to be expelled. Remember that both these medications should be taken under medical supervision. In terms of side effects, after one takes misoprostol, heavy bleeding and cramping will take place. In addition, feelings of nausea and dizziness have also been reported. It is recommended to visit a gynecologist after the medical abortion is completed. Now, let us discuss how you can prepare for a medical abortion. Before you go for a medical abortion, you should meet with a healthcare expert for a physical examination and confirmation that you are pregnant. Then an ultrasound may be necessary to view the fetus and determine how long you have been pregnant. You will then be probably told about the procedure and the risks involved with a medical abortion. Next, let us talk about what you can do after a medical abortion. Since heavy bleeding and cramping is to be expected, you should ideally try to stay at home or in a place where you will be comfortable for a few days. Try to have loved ones or friends nearby for support during this period. People have reported having feelings of nausea. Vomiting and diarrhea are other possible side effects. In addition, you may have a low-grade fever or experience chills. Ensure you have absorbent pads around for the bleeding. Medicines like paracetamol and ibuprofen can help with the fever and provide pain relief. You can use a heating pad for the cramping issue. The second type of abortion is the surgical abortion. A surgical abortion involves the removal of the embryo from the uterus. This is usually an inpatient procedure and may require hospitalization. The surgical abortion is considered an option when the medical abortion has failed, or in case the mother has crossed the 9-week mark. The most common type of surgical abortion is the aspiration abortion, and the second type is the dilation and evacuation abortion. Now let us look at how long one should wait after an abortion before they can have sexual intercourse. It is recommended that you wait at least 1 or 2 weeks before you start having sex again. In case you had any complications during your abortion, you should first consult with a doctor. Some women have noticed that sexual intercourse becomes painful after an abortion, and there have been complaints of excessive vaginal dryness. Even if you are physically fine, you should see if you are mentally ready to have sex again. It is perfectly normal if you have a low libido after your abortion. You can consider therapy or counseling to get through these issues. Next, let us look at whether you can get pregnant after having an abortion. After you have an abortion, the menstrual cycle restarts. So, within a few weeks, you will ovulate in all likelihood. So, it is possible to get pregnant soon after an abortion. It is, however, recommended that you discuss this with your doctor before making any plans to get pregnant. The subject of abortion is highly controversial. There are many people who believe that abortion should be banned. This is based on the belief that life begins at conception. On the other side, there are those who believe that every woman should have access to birth control methods like abortion. They argue that abortions are a part of human rights. While it may be true that life begins at conception, ultimately it should be the mother's decision whether to continue with the pregnancy, since she has to carry the child for the term of the pregnancy. She would have to care for the child during infancy. So, there is a lot riding on the physical, mental, and financial well-being of the mother. It is easy to make arguments that are founded on a particular religion's morality, but we have to look at the implications. Sometimes, a person may already have kids, and after an unplanned pregnancy, they can't take on the responsibility of another kid. Sometimes people are not ready to become parents yet, or they want to finish school or college before they start a family. It can also be that they are not in a relationship with someone they would like to start a family with. It is also possible that the pregnancy can be harmful to the mother due to complications that may lead to her death. So, the opinion of the mother is quite important when it comes to deciding whether to have an abortion. And that's a wrap. We have talked about the 5 negative effects of having an abortion. What do you think about abortions? Shouldn't the right to have an abortion be available to all women? Let us know your thoughts in the comments.